Right, so we'll be doing the chapter 5 of class 12th named Therapeutic Approaches. This will be the outline under which these will be the headings under which we will be covering the chapter. So, as per NCERT, what is psychotherapy is? So, psychotherapy, the definition that's given in NCERT is that it is the use of any psychological technique in the treatment of, what are we treating? Mental or psychological, which either disorders or maladjustments. So, we might be dealing with something like an acute stress reaction, which is not a disorder, it is not a disease, but it is a maladjustment to a stressful situation. So, psychotherapy may be used in that situation as well. So, psychotherapy is the use of any psychological technique for the treatment of what? Mental or psychological disorders or maladjustments. Now, what are the goals of psychotherapy? Is one, we want to strengthen the client's resolve for betterment. So, we want to improve clients' motivation to improve their current life status or the quality of life. We want to reduce emotional distress, and thereby, if there is less distress, there will also be potential for more positive growth. Then, modifying unhealthy habits, which is something which is often done in therapies like CBT and behavioral therapy. Then, changing thinking patterns, again a core feature of cognitive behavioral therapy or cognitive therapy. So, any maladaptive thinking patterns which are interfering with our performance or our positive growth or causing emotional distress would also be a goal for treatment for changing. Then, increasing self-awareness about one's challenges, what we find is easier for us, what we find, what the client finds or faces difficulties in. So, increasing the awareness of the self about these aspects, enhancing interpersonal relationships and communication. So, we a lot of times there's a type of therapy called as dialectical behavioral therapy, in which so we work on interpersonal communication and relationships and improving, and we do something called as the communication analysis, where we do role plays and we see how the person communicates and try to improve it through feedback and practicing. Then, improving decision making skills, recognizing life choices and also critically evaluating these choices and therefore changing anything if necessary, and engaging with the social environment in a meaningful way. So, all these would be the goals of psychotherapy. Now, what is a therapeutic relationship or alliance? So, it is a special bond, right? So, relationship is or alliance is basically a special bond between. So, as it is a therapeutic relationship, it would obviously be between a therapist and a client. It is not a casual acquaintance, it's not something which, so the therapist isn't a friend, and also it is not a permanent bond. So, therapy, as we all know, is a time limited intervention. Now, it exists only for the duration of therapy and aims at helping the client overcome their problems. This is the sole purpose of therapy. It is not for any socializing, making relationships. That's not the kind of goal for therapeutic relationship or alliance or psychotherapy. Now, it is contractual in nature. So, the client, both the client and the therapist know that they are willingly entering into the therapeutic alliance, and they are all, by entering into this alliance, they agree to cooperate and collaborate with each other. It is also a limited duration. Then, unique properties of a therapeutic alliance is that there is trust and confidentiality. So, the client must feel there should be an environment of safety where the person can share their personal problems. The therapist must never have a judgmental attitude, and also, as there is confidentiality, it means that the therapist should not disclose the private details. Now, unconditional positive regard. So, again, if here the non judgmental attitude comes into play, then empathy versus sympathy, this is an important distinction that we need to make in practice. So, sympathy is which we can feel for example, if we are watching a movie and something bad is happening to the protagonist, we would feel a sense of pity or compassion for them. That is what is sympathy. But empathy is that we understand and feel what the client is feeling by putting oneself in their shoes. So we will try to look at situation from their perspective. But what is important is that in empathy, even though we are trying to put ourselves in their shoes, we would still like to hold on to objectivity. Now, empathy creates a healing environment and strengthens trust. And also, there are professional boundaries between the client and the therapist. So, these are the unique properties of a therapeutic relationship where there is trust and confidentiality, there is unconditional positive regard, there is empathy and sympathy, and there are professional boundaries. Now, why is this important is because of course it builds the client's self-confidence and also confidence in the process of psychotherapy. It makes therapy more effective and meaningful. It also helps in problem solving and self-reflection, and it encourages emotional healing. So these are the various kind of therapies which we will be going across. The three main schools of thought for therapy, which would be reading, are psychodynamic therapies, behavioral therapies, and existential therapies. So all these schools of therapy mean for solving a client's problem, these schools of thought would have multiple theories about what causes these problems. So psychodynamic theory, which comes from the work of Sigmund Freud. So as per this school of therapy, they say that the cause of psychological problems are intrapsychic conflicts, which are basically unresolved unconscious conflicts, and the origins are from unfulfilled childhood desires and unresolved fears. uh, Based on what the therapist is trained in, which school of thought they are trained in, they would have some methods of treatment. For example, in psychodynamic therapy, there is free association, where the person is asked to, where the client is asked to speak without any filters. Even if something which the client might usually not say comes up in their minds, which might be something which is embarrassing or offensive, they are told to undergo free association and not judge whatever is coming into their minds, speak it out loud. Then dream analysis, where what is done is, so basically in dream analysis, this means, so as per Freud, our dreams have something are basically come, the contents of our dreams come from our unconscious the contents of our unconscious. So he said that there was something called as the latent dream and something called as the manifest dream. So even in dreaming, whatever whatever unresolved fears or unresolved conflicts are there, they would present themselves as latent dreams, and manifest dream is what lies in the pre-conscious or the conscious. So for dream analysis, the goal is to bring whatever is in the latent dream to the manifest dream. Then whatever is in the manifest dream can then be interpreted through free association. So here, what is the nature of therapeutic relationship is that the therapist interprets clients' conflicts to help them understand. So what the therapist does is that whatever conflicts come up, the therapist tries to interpret and relate them to whatever unresolved conflicts might be present. The chief benefit to the client, that is the end point which the client gets, is that they get deep emotional insights into their psychology. And the duration of treatment in psychoanalysis often, so this is one of the one of the drawbacks of psychoanalysis, amongst many others, that it may take several years or a lot of even the modern versions, which are short-term psychodynamic therapies, would take at least 10 to 15 sessions. Then coming on to behavioral therapy. Here in psychodynamic therapy said that the root cause of psychological problems is intracyclic conflicts. But behavioral therapy says that it is due to faulty learning of maladaptive behaviors and thoughts. And they say that the origin of these is faulty conditioning, which can both be either two kinds. What are the two kinds is classical conditioning and operant conditioning, and also a learning of faulty beliefs. And the chief method here is behavioral modification and cognitive restructuring. So what is cognitive restructuring is that we first identify what the thought processes of the person are, what their beliefs are, and then we identify what is maladaptive or what is wrong or what is not serving the person, or and then we try to change these cognitions through cognitive restructuring. Then the therapeutic relationship. Here the therapist identifies these faulty behaviors and then along with the client they try to correct them. Here the end goal is basically changing faulty behavior or thinking patterns to reduce distress. This is short term and lasts a few months. Usually it takes about 6 to 12 or 20 sessions. Existential therapy is also a school of thought where they see that the cause of psychological problems is the lack of meaning in one's life, feeling of loneliness and alienation. And the origin of these psychological problems or these causes come from the current existential issues. So for example, any lack of purpose that the person might be currently feeling, any loneliness that may be present. So in adverse conditions like let's say war, there might be a lot of loneliness, a lot of alienation, there might be a lot of fear, which can lead to a crisis. Now, what are the chief methods of treatment? It creates a non-judgmental environment where the person undergoes self-exploration, and the therapist acts as a facilitator. Here the therapist doesn't identify any faulty behaviors. They don't interpret, so they don't spoon feed the client as to what the therapist thinks the conflicts are and how the client should understand them. Here the therapist just facilitates, that is, just helps the client explore themselves. They just provide a support, but don't do the exploration for the patient. Here the end goal is personal growth and self-awareness, and again it is also short-term therapy. Now, when in any sort of therapy, the first step is to form something called as the clinical formulation, which is basically the process of defining a client's problem within the therapeutic model. So what model we are using, either it is psychodynamic or it is behavioral or existential, and it helps to guide the treatment by identifying the key issues and also identifying what appropriate techniques we'll use. What is the advantage of forming this clinical formulation in the very beginning is that it helps us to gain a full picture of the problem. It helps to identify the target areas for the treatment and also to prioritize. So a client might have multiple problems, but what do we want to focus on currently? Selecting the right techniques based on the therapeutic model that we are using, based on the understanding of our problem, based on the target areas, we will use the correct techniques that the person might need. And again, while we do make it in the beginning, it is still an ongoing process. So even as we go through therapy, we might make some tweaks or changes into our clinical formulation. And of course, therapy should not begin without forming a clinical formulation. Now coming to behavioral therapy, here the key concept is that psychological distress, as we talked about, arises from faulty behavioral patterns or thought processes, and it only focuses on present behaviors, unlike in psychodynamic therapy where we go back in the past and talk about unresolved previous conflicts. The goal is to correct these faulty patterns in behavior or thought patterns. The core three principles of behavioral therapy is, it is based on the learning theory principles. So again, operant conditioning and classical conditioning principles. Use specific techniques and interventions tailored to the client's symptoms, and different disorders require different treatment approaches. So it is not one size fit all strategy. Now here the method of treatment. One technique that we use is something called as behavioral analysis. So after the therapist interviews the clients and sometimes also the family, behavioral analysis is basically, we try to identify three things. What are these? Is what are the malfunctioning behaviors? For example, let's say smoking. What are the antecedent factors? That what are the triggers? So when does the person smoke? In what are the people with whom they smoke? What are the situations in which they smoke? What is the emotional state in which they smoke, etc. And also, what are the maintaining factors? So what are the reinforcers of this behavior? What is reinforcer? Anything which increases the likelihood of a behavior happening. So for example, if someone feels relaxed after smoking, so whenever they are in a sad state, they would want to smoke, and this will make them happy. So therefore, sadness becomes a reinforcer for smoking behaviors. Then the treatment process. The goal is to eliminate faulty behaviors and introduce adaptive alternatives. Uses antecedent operations, change what happens before the behavior, and consequent operations, change what happens after the behavior. So behavioral techniques, again, we know what is, we've read about reinforcement in the previous classes. So negative reinforcement increases the behavior by removing an unpleasant stimulus. So we know that reinforcement of any kind basically increases the likelihood of a behavior happening. So negative reinforcement may we remove something. What are we removing is an unpleasant stimulus. For example, wearing warm clothes in winter to avoid feeling cold. So this avoidance of feeling cold would be the would be the negative reinforcer. So an unpleasant stimulus, which is feeling cold, is removed. And how is it removed? By wearing warm clothes, which is the behavior we want to, which is reinforced. Then positive reinforcement is encouraging desired behavior by offering rewards. For example, a mother rewards a child with their favorite dish when they complete their homework on time. Then aversive conditioning or punishment, where unpleasant consequences are there for any behavior, which again which is not an ideal method, as it is seen that with aversive conditioning, with time the results are not as good as other techniques, for example positive reinforcement and token economy. Now what is token economy is that small tokens are given as a reward for desired behaviors. For example, for children it could be in the form of star charts. So if there is so usually children do not wet their pants at night. There is no bedwetting after 6 to 7 years of age. However, in some children it might persist beyond that, something which is called as enuresis. So how we use token economy in this situation is that for the number of nights that the child is dry during night, we give stars, and these are displayed, these are asked to be displayed in the home. So such star chart is created. So every time the child does something which is desirable, in this case which is keeping dry throughout the night, the child gets a star, and then these stars can be exchanged for rewards. For example, they might want some treats or outings. So for example, 2 tokens would lead to a dairy milk, 3 tokens would lead to a pack of Lays, something like that. Now differential reinforcement is again an very important and effective technique, which means that we are using a combination of both positive and negative reinforcement by increasing wanted behaviors and decreasing unwanted behaviors. So, of course, if we look closely, the two important methods here are that we reinforce good behavior and punish unwanted behavior. That is one thing that can be used, or we can reinforce good behavior and ignore unwanted behaviors. Now, systematic desensitization, specifically used commonly for phobias and anxiety, developed by Joseph Wolfe. the Here the process is that first all the fear provoking situations are identified, then a hierarchy is created from so here what is the least fearful for the patient to at the top what is the highest fearful or most fearful. Then first identifying all the fear provoking situations, then making a hierarchy and arranging them according to the level of severity. Then relaxation techniques like deep breathing or guided imageries are taught to the patient. Then gradual exposure to fearful situations while the person is also taught to maintain relaxation. So for example, if the least fear provoking situation is asking, for example, leaving the house in the early morning hours, if that's something that the person fears but it is least out of all, then here the person would be asked to do this task while along at the same time taught to practice the relaxation techniques that have been taught. Now here the principle that this works on is of reciprocal inhibition. What it says is that anxiety is weakened when relaxation is introduced. So in a fear provoking situation, usually while we'll have anxiety, if we introduce something called as relaxation, this would reciprocally inhibit the anxiety. Now modeling, learning by observing a role model. So for example, a shy child learning confidence by observing and imitating a social friend. Now talking about cognitive therapy, so there are two major approaches. First developed by Albert Ellis, something called as the rational emotive therapy, or the REBT, which is rational emotive behavioral therapy, and Aaron Beck, who introduced cognitive therapy especially in depression and anxiety. The key features is that it is problem focused. It does not go deep into conflicts and other non-specific areas. It targets specific negative thoughts. It is an open process. Unlike psychoanalysis, the therapist shares their methods with the client, doesn't just interpret and give their conclusions, and it is short term. Now, what is RET? So it states that the irrational beliefs, which are the false beliefs, which might not have any basis in reality, they can lead to negative emotions and behaviors. So here an ABC model is used. So the client is taught to identify what are the antecedent behaviors, what are those situations in which the person feels distress. Then B is the beliefs. So they are told to identify or taught to identify what are their irrational beliefs. For example, statements like everyone must love me or everyone hates me. And what happens when the person is in these antecedent conditions which lead to such irrational beliefs. So what are the consequences? For example, and how does the person feel afterwards? What does the person do? What does the person say after they have such feelings? The process of RAT is that the therapist identifies these beliefs. These beliefs often contain statements like must and should. So I must always succeed. I should always be perfect. I must always look flawless. Or I must be thin. The therapist then gently questions these irrational beliefs, that how valid these are. Then the client replaces these with more rational beliefs, and as thinking patterns change over time, psychological distress, which would be the consequence of the usual irrational beliefs, decreases. Now, the Aaron Beck School of Cognitive Therapy said that so these irrational beliefs or something called as cognitive distortions are also talked about in this school of thought. However, it says that the focus is on early childhood experiences, which are said to shape negative thought patterns, something called as schemas.
So schemas are these negative thought patterns which come out of our early childhood experiences. So how, according to this, the negative thoughts develop is that, for example, a child is neglected by the parents, or for example, there were any adverse childhood events. So the child develops a core schema. In this case, that I'm not wanted. So then a critical event happens. For example, something happens which triggers this belief. For example, public humiliation, being laughed at while presenting something. Then the person starts having negative automatic thoughts, something called as cognitive distortions, which are these must and should statements, which say that nobody loves me, I'm stupid, I will never succeed. And then these negative automatic thoughts create these negative automatic thoughts create cognitive distortions, which are irrational and negative ways of thinking. The process of cognitive therapy is that the therapist gently questions the client's beliefs. That is, for example, if the person says that everyone should love me, then they ask why should they do so. This helps the client see flaws in their thinking, and then they're encouraged to restructure. For example, restructure this statement of everyone should love me, and what would be a better alternative for it. The goal is cognitive restructuring. This is the end point, which would help in reducing anxiety and depression. Now, cognitive behavioral therapy, these are the common indications, common conditions in which we would give, and why it is often chosen and commonly used is that it is short term. It has proven effectiveness in a variety of disorders. It is structured and goal oriented and teaches long term coping skills. So, what one learns in cognitive behavioral therapy can often then be applied to their life in general afterwards. Now, the CBT is based on something called as the biopsychosocial model, which says that there is importance of both biological aspects, psychological aspects, and social aspects in our psychological distress and experiences. So, it uses relaxation techniques so that the physical symptoms of anxiety, like shortness of breath, chest pain, racing heart, all these can be reduced. It helps regulate neurochemical imbalances through structured therapy. So CBT is also shown to improve neurochemical balances. Then psychological aspects, so it aims to change the negative thought patterns, and it uses behavioral therapy techniques. CBT is cognitive plus behavioral therapy, right? So it uses both behavioral therapy techniques and cognitive therapy techniques to modify behaviors and negative thought patterns respectively. The social aspects is that it helps the client develop healthy relationships. As we saw that what we learn in CBT is something which we can take forward in normal life as well. So it helps the client develop healthy relationship and uses environmental changes to improve social support and coping mechanisms. This is something that we've done. Now coming to humanistic existential therapy. So it focuses on addressing loneliness, alienation, and the search for meaning. Here the key concepts are self-actualization. As you remember, something called as the Maslow's hierarchy, at the top of which lay self-actualization, which is basically the innate drive to become a balanced, integrated and whole person. Something usually when we say that person has achieved nirvana. It requires a free emotional expression. So something which is often we think of the society, we might not say some certain things, we might not express ourselves fully and appropriate because it often might not be appropriate. But a self-actualized person would usually have a free emotional expression. And the therapeutic approaches that, as we saw in the table that was first given, that it is permissive. So we allow the client to explore, which is non-judgmental, and we give an accepting environment because we are non-judgmental. So the client's role is that they have freedom and responsibility. They have both the freedom, so they can explore themselves and their behaviors, but they also have the responsibility that they should control their own behaviors. Therefore, it focuses on self-growth, and the therapist is just a facilitator or guide, not a controller. Now, existential therapy focuses on finding meaning in life. Logotherapy is a kind of existential therapy developed by Viktor Frankl. It says that meaning making, so finding meaning in our life, is the process of discovering the spiritual truth in one's existence. Spiritual unconscious is the storehouse of love, aesthetic awareness, and life values. So neurotic disorders like depression, anxiety, phobias, they arise when life problems are linked to physical, psychological, or spiritual aspects. So that is how we can understand these disorders through the existential therapy lens, by looking into physical, psychological, or spiritual aspects. Existential anxiety is something which refers to neurotic anxiety stemming from spiritual concerns and meaninglessness. So, what is the goal of logotherapy? Is that it helps patient find meaning and responsibility in life, regardless of the circumstances. It focuses on here and now, and it discourages what it means to have transference is basically transference is a type of it's a technique used in psychodynamic therapy, where if the client projects a uh, certain role onto the therapist, this is transference, and then this is interpreted, and underlying conflicts and unresolved fears are then come brought to surface and told to the patient, and through which the patient works through it. It also encourages, existential therapy encourages the client to recognize the immediacy of the present and find meaning in their existing environment, in their existence. Another school of existential therapy, one was logotherapy, the other is client centered therapy, introduced by Carl Rogers. Here, the core concepts are: one is self, the concept of self, having freedom, and choice. These three aspects are fundamental aspects of one human being. There is use of empathy and positive regard for the patient, and the reflection technique is used here. So what the therapist does is they just rephrase client statements for and out, so they don't change anything about what the client says, they just rephrase it, which helps the client to gain clarity and deeper understanding. For example, if again the person says that I am not worthy of anything, then how we would rephrase it is that that the therapist would say, so you are saying that there is nothing that you are worthy of, which again, if when the client hears from coming from the therapist and hearing it from someone else, the client starts to realize clearly and gets deeper understanding into what they are feeling and how much truth there is to this. Outcomes of this therapy are improved personal relationships and better emotional adjustment. Gestalt therapy, another form of existential therapy introduced by the Pearls. The goal is to increase self-awareness and acceptance of self. Here, the technique that is used is that the client learns to recognize bodily processes and blocked emotions. The therapist encourages the client to act out their fantasies related to feelings and conflicts. It can be applied in group therapy settings as well. So, what are the factors which contribute to healing in psychotherapy is that the techniques adopted by the therapist and the implementation, what techniques the therapist adopts, how valid are they to the current situation, how well they are implemented, and how much trained the therapist is and how good they are at implementing these techniques. The therapeutic alliance, how good it is and how strong it is, and the process of emotional unburdening, something called as catharsis. So when the person starts to talk about their problems, they might have let's say emotional discharge with crying or laughing, something called as catharsis, and it has healing properties. The non-specific factors can be present, for example patient factors, so how much motivation for change there is. If initially, since the beginning, if the person thinks that therapy might not work for them, it actually might not, because their motivation would be low and they would not be encouraged to do the work that is required for therapy. Expectation of improvement due to the treatment, the patient's expectation. Then the therapist variables is how positive their nature is. Are there any unresolved emotional conflicts that the therapist might have, and how good the mental health of therapist is. These are some of the ethics in psychotherapy. So informed consent. So consent is that we give complete information about the procedure, about the therapeutic process. We give information about the pros and cons. We give information about the sessions, how it would be like, everything about it. So the how, the whys, the whens, how many sessions, etc., etc. And we give it in such a manner. So informed here means that we give it in the language of the patient. We give we say use even if it's in the language of the patient, it should be understandable to the patient. So we should not use Shakespearean words. So we before even starting the therapy, we take an informed consent, making sure that the client has understood what they're going to go through as the therapy proceeds. Then the confidentiality of the client, we have to respect their privacy. The goal of the therapy should be alleviating personal distress of the client, integrating the patient client relationship, integrity of the patient client relationship, practitioner client relationship, or the therapeutic alliance, respect for human rights and dignity, and professional competence and skills which are essential. So the therapist should be well trained and competent to provide psychotherapy. Now the last part is when there is mental illness, especially severe mental illness like schizophrenia, something called as rehabilitation. That is, whatever deficits are there, if we often have to work with the patient with those deficits and improve their quality of life. So in schizophrenia, many patients might have negative symptoms which may persist. For example, apathy can be there, alogia can be there, which is a decreased in the speech output, anhedonia can be there, which is decreased interest in previously enjoyable activities, asociality can be there, decreased social interactions can be there. So rehabilitation is necessary to help patients to become self-sufficient and work in the community. And the goal of this rehabilitation is to empower patients and be as productive in the society as possible. These are the various forms of rehabilitation. So we can do occupational therapy, so teaching useful skills which can further be used by the person in their life, in domestic work or in commercial work. Social skills training. So as we saw that there are all these sort of negative symptoms that might be present in severe mental illness. So social skills training in communication, in interpersonal skills, talking and maintaining relationships, these are a part of social skills training. Then cognitive retraining, so improving the attention memory of the person. And vocational training, so providing skills necessary for productive employment so that the person can be self-sufficient and earn from there for themselves. So these are the types of rehabilitation training that can be done. And with this we come